Okay, so welcome back from the break. Still watching The Morning Rush here on Metro Television. My name is Desmond Okerekuna, so you can call me Desifani the Star Boy. I mentioned earlier that we're talking cervical cancer because January is the Cervical Cancer Awareness Month, and so we're doing our bit to make sure the awareness is out there so you get to know about it. And for the past 3 weeks, we have been talking about it with some doctors from the Greater Accra Regional Hospital. And this morning, joining me is Dr. Ntiamoah Mensah from the Greater Accra Regional Hospital, and we're talking cervical cancer. Today we're focusing on the treatment bit of it, and so let's get into it. As I mentioned earlier, if you've got any questions for her, you want to know anything, you can send us a WhatsApp message on 0553 000035, 0553 000035. So let's get straight into it. Doc, good morning and welcome.
Good morning. Thank you.
How are you doing?
I'm fine. You're fine too. Yes, everything.
January is running, eh?
It is, and I'm happy about that.
Of course, everybody's happy about that. But we've been talking about cervical cancer. I mean, has there been any? Have people been coming in since we last spoke? What was it like?
Okay, so this month is Cervical Cancer Month. People have been coming in because most of the health facilities have been offering free screening and then increased awareness.
Okay.
So I've seen that there has been a bit of an increase in turnout in our departments, but
yeah, I mean, we hope that a lot more come in. The range, the older women or the young ladies?
I think that it is the older women who are becoming a bit more aware. The younger people, we always think that sickness and disease is very far away from us. So everyone is living their best life. Everyone is just living their best life.
Living their best life. I like that. So now to the treatment of cervical cancer. We've talked about the definition as just cancer of the cervix, really. That's what it is.
Basically.
Basically, that's what it is about. So if someone has it, when someone comes to you, you diagnose, you see that the person has cervical cancer, what's the next step from there?
Okay, so with diagnosing cervical cancer, you come out with stages. There are different stages. In some of them, it has not yet become a full-blown cancer. And then in some stages, it is a full-blown cancer. And even with a full-blown cancer, there are the early stages and then the later stages. So the treatment modalities are very different in all these stages. Okay, there are stages where they will just look at where the lesion is and then take that out, called conization. And then you even have the later stages where they may take the whole uterus, the cervix out, and then they may also do radiotherapy. So it is all in a spectrum. And that's why I say that early detection saves lives, because when you are detected in the earlier stages, there is a greater chance of survival. Okay. I read on a WHO website that there's about 90% survival. That cervical cancer is one of the cancers that has one of the best survival rates if detected early.
90%?
Yes, and that is why we are here today.
Okay, so you've gone through the stages. At every stage, what sort of treatment will be given? So that we know how it is like. Those that are probably now getting it, it looks like they would get it. And then those who've gotten it from the first stage to all the other stages. I know there's some other, I read some things I might have forgotten.
Oh, tell me what you read.
I know there's the surgery is the last bit, right? And there's one in the middle between medical and surgery.
Where they just take a part out the loop excision. So yes, with when they see that there is a pre-malignant change, you do not go in and perform any procedure, but rather they keep surveillance. So you come in and then they keep on testing. Because last week, my colleague explained that HPV, being infected with HPV, the human body usually clears it out, but it's with people reduced immunity that becomes full-blown cancer. Good. So you test and then there is surveillance. And then when we see that it has become a full-blown cancer, let me just use lay terms because medical jargons can be boring. When you see that it has become a full-blown cancer, there are stages where you will do something called conization or an excision biopsy, and then there are stages where you just take out the cervix. There are stages where you take out the cervix, the uterus. There are stages where you take out the whole thing, the cervix, the uterus, the fallopian tubes, and then radiation therapy as well. So it's all in a spectrum, right? And I wouldn't bore you with all those specific details, but all I like to say is that it is something that when you test early, when it's detected early, it is treatable. Treatment is available. Unlike some other cancers where treatment is not available, you would have to go elsewhere, and then there are a whole lot of things. But for this, treatment is available. So if you are detected and you detect early, there's a very, very high chance of survival.
Okay, so there are some pictures rolling on the screen, and let's pause this one. Let's pause this one. Okay, so I want to understand the stages. I mean, so that people can actually get to know what we're talking about, right? So I guess the first, as it's been written there, that's the normal one.
That's the normal cervix.
And then there's
when you get to the stage 1, that's you are illustrating.
So that is where the I don't know what I'd call that.
The cervix is like the mouth of the uterus. You can see the uterus, and then you can see it comes down, and you can see where the lesions are. Is the cervix, and then when you come down, the place that's a bit rough, that is like the vagina.
Okay, yeah.
Good. So this is the cervix that you're seeing. So we say that cervical cancer is cancer of the mouth of the uterus or the cervix.
Okay.
So that is what is being illustrated. And then these are stages. So let me use the word encroachments. These are stages of sort of encroachment, where one is just out there, and then it goes in, it travels in, and then it gets to affect something that we call metastasis. It goes to affect the whole uterus, the whole fallopian tubes, and sometimes go into places like the lungs. So this is the stage of progression if you're not detected early, and then treatment modalities are not certain early.
Yeah, so it's just like it starts very little.
Exactly.
And if it's not detected, then it keeps spreading.
That is the basis of it.
So that does that affect childbirth?
Well, I would. Well, people with cervical cancer can't get pregnant, but you know that with every carcinoma and with everything that is affecting the uterus, the cervix, it will really reduce the chances of getting pregnant. You will not be able to carry the pregnancy to term because it's going to continue the progression of the disease, and the baby may not be able to survive. But there have been some studies that show people who come in and then they have some pre-malignant lesions or some malignant lesions and they are pregnant, and that really disturbs treatment because what are you going to do?
Yeah.
Are they going to carry the baby to term? But yeah,
so after all this, when you do not go to the hospital to check on it, the last bit is when you've got to do surgery. Oh?
Okay. So it's not only the last bit that you have to do surgery. There are stages, and then in some of the stages, a surgery has to be done. But then when you get to the final parts, where there is nothing else that can be done for you, where we find it very important to take out the uterus. Then
so the final part is taking out the uterus.
So yes, there's something called a radical hysterectomy. You take out the uterus, the cervix, the fallopian tubes. You take out everything in that region that may harbor the cancer to prevent further spread. Yes, and then you also do radiation so that if it's in any other parts of the body.
You take everything out?
Yes.
Then if you take everything out, what then makes you a woman? I mean, I'm just saying.
Being a woman is not just the function of the uterus.
No, but the uterus is a very important, part of the human body.
It is, and that's why we are saying that people should come in, people should get screened, people should be aware, because definitely it is not a pleasant thing to get to that point. So yeah, people should come in, people should get screened, people should get vaccinated, because one person being vaccinated affects the lives of so many. It's like a community. So if more people are vaccinated, less people are going to be transmitting the disease. So it's,
Okay, so you can send us your messages 0553 000035. Today, Dr. Erica is taking us through a proper seeing all that. I mean, with the diagrams and everything that we're showing on the screen, it just goes to tell us that we really need to take this thing serious, and not just with the women. They need encouragement from the men also, the husbands, uncles, aunties, brothers, boyfriends, whichever way. And do not forget that last week they mentioned that we could get not cervical cancer, but we could get infected from that. I mean, for those of us who will be hearing this for the first time, we can just take us through that again.
Yes, so some men do not have cervixes, right? But HPV does affect men as well and gives them their own type of carcinoma. So don't think that you are fine, you are okay. It's something for women, but men can also be affected. So that's why vaccination is there for both men and women. When men get vaccinated, it reduces the transmission and also protects you against forms of genital warts and also cancer as well.
Yeah, true. The way you did. So we all need to go into. So so the treatment, that's all about it.
Well, it is very expansive, but all I like to say is that cervical cancer it can be detected early. it is preventable, it is treatable, and the treatment is accessible. Unlike other forms of cancers where when you are diagnosed, you're like, oh my God, I don't know what to do now. But treatment is accessible. So if there's someone out there who has been diagnosed, and they shouldn't think that all hope is lost. Or if there's someone out there who is experiencing some of the symptoms that we've spoken about during the weeks, they shouldn't think that all hope is lost. They should contact their nearest health facility. They shouldn't feel like all hope is lost. They should contact their nearest health facility, and then the treatment and the management will be taken from there in stages.
Okay, so this message from Charlotte, Complete Women Academy, says that Dr. Ntiamoah, thanks for this insightful lessons. God bless you. Okay.
Oh.
So Charlotte sending that one.
Good morning to my Complete Woman Academy.
Okay. All right. So that's from who?
Yes.
Oh, okay.
Thank you for watching.
Thank you very much for watching that. So I mean, basically, we need to take this very serious. And you were talking about the fact that I think it was when you were here with women in medical.
Yes.
No, it was when Dr. Eva Vera was here around that it should be something that is being the NHIS needs to cover. How important is that for persons who will be thinking that this is expensive, we cannot afford it and all that, the treatment. The treatment. Yeah, or even the going to the hospital to check it. Okay. So with the screening methods, we do not only do the pap smear. We do visual inspection under acetic acid. We are in a third world country, so we've adjusted all our medicine and treatment modalities to suit our climate. Let me just put it that way. So in screening, well, everything is an opportunity cost. Some may be very expensive, but some are moderate. So I believe that just once a year, once in 5 years, it's something that someone can sacrifice to do. And then we talk about vaccination. Vaccination currently is on the high side, but I believe it's something that our ministries are looking at to incorporate into the NHIS. And there have been a lot of non-governmental organizations that also do vaccination rollout. They go to schools and do things like that. So I believe that is also in the works. And with treatment, well, we pray that it becomes, although it is accessible, it becomes more affordable. More affordable for everybody. For everybody. But what do you hear from people? Do people say, I mean, this is nothing, to put herbal medicine into disrepute and everything like that. But do people come to you like, oh, all of the, do you hear some of those things? We are in Ghana. That's the only answer I can give on air. We are in Ghana. So yes, definitely people always come in taking all sorts of concoctions. Their mother told them they should grind ginger and use for this. Their father told them this and that. So that's something that is so common. Last week I had a patient who told me that he takes blood of Jesus tonic. He had anemia, and then he said he takes Yesumo. I was just wondering, it's like, oh, it's a herbal tonic that they take that. So, I mean, this is Ghana. Yes. Anyway, Doc, thank you so much for coming this morning. It's been insightful these past 3 weeks talking about cervical cancer. Those of us who had no knowledge about it, now we know about it. We need to spread the word out there, and that's what we've been doing on the show in this month of January. So this will wrap up the show. Doc, thank you so much for coming. Wish you the very best in the day. And also big shouts to Dr. Eva Vera. Say hi to her. Yeah. For us. So many thanks for watching the show as well. I need to say goodbye to you. Tuesday, 17th day of January 2023. Many thanks for watching, all the audience on Facebook, also on our DSTV channel 277. Thank you so much. Big shouts to the production team led by Josiah Tope. Earlier, Zoe brought us the news updates. Nana Yopoku brought us sports. And the Chan tournament continues here on all Ignite Media platforms, Metro TV, Original TV, and also Original 91.9 FM. My name is Desmond Ukrekud, as you can call me, Desifading the Star Boy. Remember to dream big, shine bright, and sparkle. I'm back here tomorrow, 5:30 a.m. Let's do this together. Enjoy the rest of our programs. Up next is Good Morning Ghana with Dr. Randy Abe. Bye-bye.